Hello, my name is Janelle Gardner. I am a registered respiratory therapist and trainer with Neonatal Rescue. In this video, we will cover the newborn monitoring sheet that has been provided with your NeoLife ventilator. The purpose of this monitoring sheet is to help the healthcare providers systematically document medical history, findings, and treatment. The first portion of the newborn monitoring sheet consists of patient information and identification. This section includes places to document the baby's name, identifier number, birth date and time, gestational age in weeks, birth weight in grams, and location. These details help to prevent data mix-ups between patients. It is important to note that to prevent confusion, special care should be taken when documenting on multiple babies from the same mother. In the next section, we will document the patient summary. Here, the provider will document the reason the neonate is being ventilated. Common reasons include birth asphyxia, infant respiratory distress syndrome, and sepsis. The provider may write in any additional reasons for ventilation. It should be noted that the provider may select more than one reason for ventilation. Next, the provider will document the type of treatment being implemented. This will include the mode of ventilation the baby has been placed on. Options for this section include medical gas CPAP, pump ventilation, and medical gas-only ventilation. The provider will also document the start and end dates for the use of the ventilator. The patient outcome is also documented. The options provided for patient outcome include extubation, facility transfer, and terminal extubation. The next section covers information about the care provider. Here, the healthcare professional may include information such as their name, credentials, initials, signature, and date signed. Because this is the only place on the sheet where a full signature is required, it is important to include the caregiver's initials so they can be paired throughout the documentation. The second page of the newborn monitoring sheet covers additional patient information and ventilator settings. The healthcare professional first records the date and time of the ventilator check and assessment. The patient's condition in regard to the level of consciousness is documented. If the baby is alert, the caregiver would write the letter A. If the baby responds to verbal stimuli, the caregiver would write the letter V. If the baby responds to painful stimuli, the caregiver would write the letter P. If the baby is unresponsive, the caregiver would write the letter U. The healthcare provider also records if the baby is currently sedated or medicated. Finally, the patient's position is recorded. Here, the caregiver may indicate if the baby is lying on their left side, right side, supine, or prone. Once the provider is finished documenting the patient information, they may begin recording the ventilator settings. Patients should be monitored closely, and ventilator checks should be performed at least every 2 hours. If adjustments are made to the ventilator settings, the initial settings should be first documented, followed by the changes. The caregiver begins by recording the current ventilator mode at the time of the assessment. Then record the set inspiratory time in seconds and the set respiratory rate in breaths per minute. Next, the caregiver records the set flow in liters per minute. The flow may be read as indicated by the flow meter located on the side of the ventilator. Because total flow is being recorded, be sure to include the flow from the ventilator pump as well as any attached medical air or oxygen being supplied to the ventilator. The caregiver may then record peak inspiratory pressure. This can be done by looking at the pressure gauge on the ventilator and noting the highest point of pressure when the baby inhales. This is recorded in centimeters of water pressure. The PEEP can be documented by looking at the pressure on exhalation. This is also recorded in centimeters of water pressure. Finally, the liter flow of external air or oxygen being supplied through the ventilator ports is recorded. The amount of medical air being supplied is documented in the top half of the box, while the amount of external oxygen being supplied is documented in the bottom half of the box. This value is recorded in liters per minute. The third page includes patient data and the patient distress score. The patient data portion has places to record the neonate's temperature, heart rate, and oxygen saturations. The baby's chest rise on inspiration should be assessed and recorded as being good or poor. For poor chest rise, consider making ventilator adjustments. If using a monitoring system, the baby's exhale tidal volume may be documented. When available, a Wright's respirometer may also be used to measure the neonate's tidal volume. This may be done by measuring the minute ventilation and counting the respiratory rate. The minute ventilation is divided by the respiratory rate to give the total exhaled tidal volume. Next, the caregiver may record the infant's breath sounds. Be sure to listen to both sides of the lungs and document the findings. The final box in this section gives the caregiver space to record any additional patient data. When available, this may include end-tidal CO2 readings or arterial blood gas results. In the next section, the healthcare provider may document the respiratory distress score. This score is divided into 3 sections: respiratory rate, retractions, and grunting and nasal flaring. For more information about scoring these, please see the references provided in the respiratory distress score module. A final calculated score is recorded in the bottom box. The last page of the newborn monitoring sheet covers safety and interventions. This section includes documenting the set high and low pressure alarms. If a safety check has been performed, it should be documented here. The safety check includes inspecting the ventilator battery levels and ensuring the connections are tight. It is especially important to document any aspects of the safety check in which the ventilator may have failed. The safety check also includes examining the neonate's skin for sores or signs of breakdown. If noticed, the physician should be notified and the neonate's skin condition should be documented. In the final section, any interventions made by the caregiver may be documented. If the baby has been suctioned, include the amount, consistency, and color of the secretions. Indicate if changes have been made to the ventilator settings. If changes have been made, mark a Y for yes, and complete an additional entry with the updated settings. To conclude the documentation, the caregiver provides their initials. These initials should match the ones on the caregiver log on page 1. The notes section can be used at any time to note something that does not fit in the boxes above. Any narrative about the patient's condition or response to the ventilator, problems, concerns, etc., can be documented in this space. Be sure to include a date, time, and signature for each new note. Please store the completed monitoring sheets and look for further instructions from Neonatal Rescue about the collection of these forms. A blank monitoring sheet can be found in the module online. Please contact us with any questions at training@neonatalrescue.org.